It's Fertility Tip Tuesday with Dr. Raquel, and yesterday's and last week's Ask Us Anything went so incredibly well. We're doing it again. You can ask Dr. Raquel, our first and only naturopath in fertility, fully integrated into fertility care practices, any question that you want on this live. She's going to be joining in just a second. If you haven't been following her on her channel, she's at The Fertility Advantage, and she is fantastic. Remind everyone about Dr. Raquel is that she had to learn all of the pharmaceuticals and all the nutraceuticals while she was going through her medical degree. So she is a full-fledged MD. This is not a certificate. That she is a fully practicing physician, and she has adopted this just incredible practice to focus on fertility optimization, to focus on helping people with IVF. So it is. And of course, Instagram is doing the waiting for the Fertility Advantage. She's coming, I promise. So get those questions started, everybody. We are so excited. Yesterday, with the Monday Motivation with Dr. Chen went awesome. And so we really kind of want to keep this thread going. There she is, the beautiful, vivacious Dr. Raquel. You make me like so motivated to start doing my hair on Tuesdays.
It's just easy. You just like, to me, I feel like, especially like everybody working virtually now, it's like, let me just keep this makeup on for
it's so good. And sometimes it's just a red lip. I feel like a red lip can change everybody's life, right?
It just makes your day better.
It just does. I know. So last week we had so much success, letting people just have an open dialogue with us. And so we wanted to do the same thing again today. We've already got some folks coming in. You suddenly got very big in the Instagram screen.
Oh no!
You're like, it's like your big, beautiful face, but it definitely it made you big.
Oh, let me see how I can change it.
Okay. Yeah, it's like that close.
Oh, like super close.
Yeah,
okay.
yeah. It made it super close all of a sudden for some reason. All right, so we've got some questions coming in. While you figure that out, K-Clegs21 recently went through IVF and had all abnormal embryos. Oh, we hate hearing that. Is there anything we can do to improve our results with round 2 of IVF? Such a great question, because with a naturopathic integrative medicine practitioner, doctor, now you're normal again. Okay.
Maybe it's just the filter not being normal.
Oh, okay. So yes, this is such a good question, because that's exactly one of the benefits of what you do. So why don't we walk her through kind of how you improve egg quality, how you kind of improve IVF outcomes, and even mention some of your data. Your data is incredible.
Yeah. So that's actually the population group that I normally work with. It's couples that have had unsuccessful IVF or IUI cycles, or even egg freezing cycles previously. Mm-hmm. And so what I always recommend is really finding a doctor to do a deep dive into your heavy metal exposure. Sometimes because these egg cells and sperm cells are so susceptible to oxidation, it can cause like chromosomal abnormalities in the quality of these eggs and sperm. And of course, it's going to also affect your embryo. So I would suggest first getting your heavy metals tested to see if you have been exposed, and then doing about a 6 to 8 week detox to just kind of clear your body of any excess heavy metals, or any metals, not just like it doesn't only have to be like mercury, but it could be arsenic if you live with a smoker.
If you've been in California, right? With like all this smoke inhalation, we don't know, right? You see it on your car and you're thinking, I've been inhaling that.
Mm-hmm. Exactly. Yeah.
Yeah,
exactly.
So those are great things. But you also work with people's gut health. You also kind of, you do all these antioxidants, the glutathione that you talk about, the anti-inflammatories. So there's so many different things. And I feel like there probably is a lot of room for comprehensive studies about the cause and effect of those types of things. But you're so focused on kind of the whole body that you really get people not just set up for achieving pregnancy, but I feel like for having a really healthy pregnancy.
Right, exactly. And that is where we are hoping that the shift will happen. It's not just helping people when they already know something is wrong, but really attacking I always like to say like proactive wellness, like proactive fertility wellness, to not just like wait until something is wrong, but really while you're thinking, if you're like, I just got married, but maybe in 5 years or however long the case may be, just really optimizing your health now. So when it gets there, you know, you can thrive and you don't have to kind of worry about some of the things that come with fertility.
Yeah, exactly. Okay. Yeah. Gloria Mata is in her beta waiting for IVF on day 7 and did a urine test yesterday and it was negative. Oh, I get it. She's in her 2-week window. Okay. She's on day 7, 2-week window, and it was negative. Don't test. Yeah. So that's we were talking about that yesterday too. We're like, sit on your hands. Do a lot of self-care. The hardest thing is to start testing at home because it's the reason it's called the 2-week wait is because we want you to wait the 2 weeks. We want you to get into the doctor's office and get your beta on Friday so you can get a real HCG level because sometimes it's just too low this early to show up on any at-home test, and we don't want you to go through the heartache or add stress on your body, you know, while we want you to be in like total self-care mode for the 2 weeks, right? We talked yesterday about It's okay. We talked yesterday about doing a lot of self-care, writing thank you cards, you know, being in like a space of gratitude during the 2-week wait. So also go back to that episode, Glory Mata, with Monday Motivation from yesterday with Dr. Serena Chen, because there were some other good audience members giving us good ideas too about self-care you can do. Definitely the right time for your partner to give you lots of foot rubs and back rubs and everything. But 100%, we don't want you testing for this very reason. It just plays a mind game on you, and it's not helpful. Another great question just popped in. Danny Girl 01, how do I lower my FSH level?
So FSH is actually sent down from let me go back. So FSH is sent down from your hypothalamus. There's a small gland at the base of your hypothalamus called the pituitary gland. And so that is what actually sends FSH sends down FSH every month. That FSH then communicates with your ovaries, because literally FSH means follicle stimulating hormone. So it's literally telling the follicles to start developing this egg for maturation. What that egg does is that it releases estrogen, and then once it gets to a certain level, it cuts FSH off. So where estrogen is downstream, FSH starts at the brain. So there could be something wrong hormonally, but more so you would have to find a doctor, and I don't know the right word or the right name of these doctors, but you would have to figure out what is going on, like sometimes neurologically, if it's something like that is affecting this hormone receptor from sending it the right way, or if it is something maybe more downstream that's affecting the FSH. So it could be anywhere from like brain level to, you know, until you're getting down to the estrogen and the other hormones, but you have to first figure out like where that block is happening. Right. But high FSH could mean that you are in premature ovarian failure or early menopause and things like that. So,
but it doesn't always, and I think that's where where we like people staying off of online forums and web research and just coming on the Fertility Answers platform. You know, you can let us know what your FSH is alongside your other labs, and then ask that same question even of all of our REIs and all of our scientists and researchers and geneticists and so forth, because they'll look at your question and they'll see that question about, you know, lowering high FSH, but they'll see your age and then they'll see your other statistics along with it and be able to answer. You know, that's why we built the platform that we did, and it's available on iOS and on Android. And I just love so much that Dr. Raquel never skips any steps in explaining, you know, like it's not always, it's often treatable. It's not always, it doesn't always mean premature ovarian failure. So,
and that's so important, because even when I worked previously with an REI, and even now how I work virtually, I still work in conjunction with different REIs. Right. And it's so important to have conversations with like-minded people, because sometimes you don't realize like your frame of reference is what you learned in medicine, what you study in your journals, but there is so much more information out there. And sometimes when you dare to just like look a little bit to the left, like well, my patient has premature ovarian failure, but it doesn't really make sense. And so sometimes when you can collaborate with other doctors, you can see that there are other things contributing. So
love that. Yeah. Love the collaborative care model. It was something we implemented when I built the Oncofertility program with a great doctor out in Colorado. And we would run monthly multidisciplinary meetings together to review 3 cases every month. And it was always centered around, you know, a cancer patient and reproductive outcomes. But it was so great having so many different perspectives bring things up that, you know, you get myopic, right? It's impossible not to. It's like you learn from, you know, what you learned and you train the way that you train. And I do love that experience. I've seen it work over and over. It's kind of another benefit of having 14 to 15 different types of specialists in our app, right?
Yeah, exactly.
You're the only naturopath, but we've got, you know, so many different levels of board certified professionals that can weigh in. Which I love.
Yeah,
Dana Lynn, this is a curious question. So Dana, and this is perfect follow-up to this conversation. So Dana Lynn, X27, she was told she has premature ovarian failure. She's also getting the gastric sleeve done. She's wondering if losing the weight will increase her chances for successful IVF.
So that's a really good question, because we do know that obesity does play. There's a direct link between obesity and infertility, and mostly because of the inflammation that comes as a result. So I can't say if it will. It absolutely will. But having your weight lower or being able to like lose weight through a gastric sleeve, or even if anyone else is doing naturally, it really will have a positive correlation on your fertility for sure.
Right. And then and I would go back and also just confirm, maybe even seek second opinion about the premature ovarian failure, depending on your age, Dana Lynn. You know, in the context of this conversation, weight can also throw off numbers, right? Because estrogen is stored in fat. So so that I would be very curious to kind of, you know, see all the lab work, and, you know, depending on your age, if you have, you know, 6 months to a year after the gastric sleeve surgery. But we've seen a lot of success with people who have had the procedure done and gone on to have very successful IVF outcomes. And I'm encouraged for you. And if you want us to help you find a second opinion consult virtually, we do that. So DM me if you want to, you know, use one of our doctors for that. That would be a good, I think, a really good second opinion kind of consult request to just confirm, is this really premature ovarian failure, or are the labs off because of the other things going on in her body right now? Let's see. DJ Law. Okay. I think it takes me a minute with people's handles sometimes. DJ Law LZ. I think I did it right. Advice for trying to conceive with PCOS. She's got tons of it.
I know.
She has so much advice for PCOS. And we've done a lot of episodes on PCOS, and we'll continue to do them.
Yes. It's like, and it's so funny because I actually talked to an REI the other week, and the way she looked at it was so different than I did, and it was amazing. I love like learning from like, especially women, but I love learning from, like, you know, brilliant women. But so with PCOS, you know, I previously thought that you had to have like all of this criteria to diagnose PCOS, and that's not true anymore. You only have to have 2 of the 3 criteria. Yeah, and
they're visual criteria, right? I mean, it's not even like even your AMH number isn't part of the criteria, is it?
Oh yeah.
Right. So that's the hard thing with PCOS, is that we need better diagnostic criteria that isn't so just visual and a bit subjective.
Yeah, but as far as treatment, the biggest thing with PCOS is going to be making sure you're monitoring your insulin resistance or your insulin levels, because insulin is what affects implantation, and so that's why women with PCOS have such high miscarriage rates. So I would recommend really attacking your diet head on, either through like a nutritionist or a naturopathic doctor, or even an integrated MD, to really look at how you're balancing every meal, making sure you're having like adequate protein and fiber, because this is what helps you make sure you don't have that insulin yo-yo after every meal, but that there is a slow like incline, decline. You eat a food, okay, this responds, and the spike goes back down. So really making sure that you are getting adequate levels of like protein through like chicken, fish, salmon, whatever you like, and then having a really good fiber through whole grains, and pack your plate with vegetables, especially green leafy vegetables like, you know, kale, broccoli, Brussels sprouts, because these are going to also help you clear excess estrogen. So diet is going to be key. And I know it's hard because in PCOS it's so hard to lose weight.
And we know it's
anytime
hard.
diet is hard, especially in the age of quarantine. Yeah,
I know it's hard for me. I'm realizing my hair is driving me crazy today. Like for me, it's, I don't have PCOS, and like this year just with food, it's been really hard.
Yeah.
And like not really motivated to, eat the salads or make the healthy meal. A lot of, I support Postmates a lot. I support Grubhub a lot. Keeping the gig economy going.
Exactly.
But we never talk about this without really like a ton of empathy around some of the challenges that that each individual person faces. We have a ton of content on YouTube though that Dr. Raquel and I have done around the topic of PCOS. We've covered metformin. We've covered what your poop can tell you about yourself. We've covered Clomid. We've covered different meal plans like keto. We've discussed this a lot, and so just know that this advice is not all that's available to you. Right. And if you have even more specific questions, you're always welcome to ask them too on the app. But we do have a ton of content out there. Let's see. Leslie asked, 5 months post pill, trying to conceive with no luck. Super normal, Leslie. And she had one unassisted pregnancy 4 years ago. How do I approach getting a checkup with my doctor? Gosh, that's such a great question.
That's such a great question because unfortunately, if you do go to like, an OBGYN or a primary care doctor, they'll say, oh no, it's not the pill. Like, just give it time. But what's a very important piece about birth control is that it depletes all of our micronutrients. And for some women, you have to think about how all of our bodies are different. Some women can literally get off of birth control and get pregnant.
Like that. Well, some people get pregnant on the birth control pill.
Literally, one of my old employees was on birth control.
Yes.
And got pregnant.
Happened to a dear friend of mine.
And 2 times in a row, not even once or twice. So you really have to think about your own body, your own story. But birth control, in fact, depletes all of your micronutrients. And Dr. Brighton, who's also a very brilliant ND, she has a book called Beyond the Pill. I would definitely recommend that.
Amazing.
But she really gives you resources on how to help to restore your micronutrients to just help not just with fertility, but hormonal balance.
That is really, I'm energy too, right? I mean, if you're low on like your B's and especially right now in the pandemic, check your vitamin D, check your B, check your C, like check everything, right? So I didn't know that about the pill. That's really fascinating because we focus a lot on the REI side. There's a lot of focus on the pill does not cause infertility. And but I've never, my mind is blown. You're the first person to ever bring up this micronutrient depletion. And we know that like metformin blocks, is it the B12?
B12. B12, yeah.
So, we do know about some contraindications around, when you take supplements and when you should take, your prenatal if you're on metformin. I knew about that, but I had no idea about the pill. And that's a super important one. I'd also say, sorry, go ahead.
No, I was just saying, I know I did a lot of like women's health shifts at my old school. And one thing that a lot of my supervising doctors would do if a woman really just needed birth control for like period cramps or just like bleeding that they could not control and they still need the birth control. I don't remember the company, but there's actually a supplement that you can take, and I can't even remember the name, but it's birth control support. So if you're taking birth control, there's a supplement that you can take that restores all your micronutrients. But I'll look into it, but it's a really amazing supplement.
That's amazing. Okay, we're going to, we'll look into that and make sure we get the name and we'll post it to everybody. I also would say, like, how do you approach this with your doctor? I mean, my advice with people when it comes to advocating for yourself is that if your instinct is, hey, I didn't think this should take this long. Yes, it's totally normal. So be prepared for your doctor to say, it's normal. But considering that you're kind of getting up to that 6-month mark post pill, it's 6 to 12 months, like within, like now I feel like, okay, go ahead and ask her for a complete workup. But I would do day 3 hormones. I would advocate for those. Ask her for your day 3 hormone labs. And then I would also ask for the micronutrient workup specifically for that reason that Dr. Raquel stated. And Leslie G, go in with the study if you have to, or have it ready on your Zoom telehealth call with your primary care doctor or your OBGYN that can order those. But that's how I would approach it. I would just say, it'll put my mind at ease, and I don't want to be, overthinking this, but I am concerned, that things haven't returned to normal. The other thing that I also advocate for everyone is when you do want to be empowered with your own data, is consider at-home ovulation confirmation tests. Because like the uva.life kit is great because it'll tell you if you had a progesterone surge, so you will know whether or not you're releasing an egg every month. So if your cycles are normal and you just haven't, they have returned to normal after being on the pill, that's just another piece of data. So you know whether or not your fertile window. Yes, it'll tell you that too, but it actually will tell you if you had a progesterone surge, which only happens if you release an egg.
Yeah.
I only know this because I've been so well educated by Dr. Raquel. Okay.
You don't even need me on these things.
Yes, I do.
You have it down.
I don't. I know. My honorary MD.
Yeah.
Let's see.
Yes.
Court image. Well, I don't know. Kanye got like an honorary PhD. So like, come on. Somebody make me a certificate.
I know. Like, why did I even go through all of this?
Right? Exactly. Court T. Mitch. Is there any correlation between gluten sensitivity and infertility? Totally. Possible PCOS. Research. She was just diagnosed with gluten sensitivity, and she's on cycle 2 of Clomid. So yes, that's an awesome question.
That's an awesome question, and the research is overwhelming.
Yeah.
Gluten sensitivity is tied to so many things, and especially miscarriage. So if you literally just Google gluten and miscarriage, the articles will just fly. And it's because when you have this sensitivity to gluten, it sets off an inflammatory response. And so anything your body comes in contact with, it attacks it. That's why people that have, what's that gluten?
Celiac.
Celiac. People that have celiac,
they
can't have even a little bit.
Not even a tiny bit. Yeah.
Yeah.
Usually like a mess. Yeah.
Yeah. It completely destroys their gastrointestinal lining. So
Right.
imagine what that'll do if you're trying to get pregnant. It's
Exactly.
going to, really give your body a hard time to implant anything.
Right.
Because your body's so hyperactive that it'll literally see this developing fetus as a foreign object and get rid of it.
Right.
So,
now, kind of interesting too with this possibility of PCOS. So if she had a gluten sensitivity and also insulin resistance, she had sort of a double whammy going on with like inflammation, right?
Yeah, exactly. So, you have to attack that first.
Yeah. And so the good news is you now know, and you can just literally be gluten free.
Right.
And that I think that the hidden places of gluten are harder. I try to, even for myself, avoid like all sauces of any kind that somebody made, it comes in a bottle. Yeah. It's like there's so many chemical versions of, gluten. But that's the good news, Court T. Mitch, is that you found out and that you know that there's something really specific that you are already tackling to improve your outcomes.
Exactly.
And depending on your age, just on the Clomid, we always recommend, no more than 6 Clomid cycles. Mostly after 3, people with PCOS would see success. That's what Dr. Chen was advocating for yesterday. And so now that you're on cycle 2 and you're kind of optimizing things in your body, maybe look, just consider trying to keep your blood sugar stable through the day through some of the nutrition recommendations Dr. Raquel already mentioned. As kind of another proactive thing you can do just in case you're trying to sort of stave off PCOS symptoms themselves. Yeah. Yeah. Because it's not going to totally go away, but we can help you mitigate the symptoms. So let's see, Alyssa Gregory. She's going next week to get polyps removed from her cervix. Sorry to hear that, because any type of procedure is not something to look forward to. But the after part, will conceiving and or IUI be more successful with those being removed? Do you feel like that's, we have a reproductive surgery talk coming up, actually.
Oh, that will be perfect.
Which will be a good one with Dr. Ganala. So Alyssa, that's probably a little bit outside of Dr. Raquel's house, but I will say that if their polyps are large enough where your reproductive surgeon recommended removal, it's for a good reason. Yeah. And so I would just say go into it, knowing that you should be more successful, because if there's something blocking the sperm getting, having like full access to your eggs, then certainly one would expect that getting them removed would lead to better outcomes. And we wish you all the best with that procedure. Please know we'll be thinking about you, and let us know how it goes. And if you'd like a second opinion in the meantime, just because you want more facts about it, I can set you up with a consult with Dr. Ganala, who can do a virtual consult with you. He's an amazing reproductive surgeon. So not every REI does do surgeries.
Exactly.
You know? And he in his practice, he's part of the only mother-son team in the whole country, which is so cool. And his mom is a total pioneer in the field of reproductive medicine. When she was a fellow, there were like 2 other people, and that's it. And she, and you know, she was like one of the very first female REIs.
I love that.
It's so great. Yeah, I love it too. Kay Cleggs, 21. Thank you for the affirmation. She said, thank you so much for the information. Love this platform and openness of sharing. Like, we love you guys so much.
I know.
We want everybody to have their babies. That's what we want. That brings tears to my eyes though, because this is why we do this. Advice on the ovulation kits from Lauren. Lauren, always good to see you. Using Clear Blue shows high fertility and peak. How often should you have intercourse? So first, let's address just the different types of ovulation kits, and that not all ovulation kits can work for every person. So if you have PCOS as a for instance, then Clear Blue isn't the right kit. And Lauren, I remember seeing you over and over, but I don't remember all the details on your story. So I'm not sure if you have PCOS or not, so remind me. But the reason is, and Raquel can answer this better than me, but it's because your LH is unreliable. People with PCOS have LH all over the place. Often it's just elevated for the whole entire month. And so Clear Blue is only LH. So it does work for a massive amount of women. Great. You know, that gives you the fertile window. But it doesn't confirm if you've ovulated, and it's really not indicated. And they say it on their website. It's not indicated for those who have PCOS.
Exactly.
Now, what about that question about how often should you have intercourse? It's like every other day, right?
Yeah. So actually, some of the research that I found, especially for my patients that are trying to conceive naturally, is that you want to make sure, and like you said, when it comes to PCOS, you really have a hard time ovulating, or you don't ovulate at all, or, you know, it's your LH is surging when it should not. And so what you want to do is, if you do know when you ovulate, you want to make sure you are maximizing your fertile window. So sperm lives in the reproductive tract for 5 days. So instead of just having sex on day 14, sometimes when you get to day 14, it's too late.
Yeah.
So you want to make sure you're having sex like days 10, 11, 12, 13, like leading up to ovulation, because that's when that egg is really at peak of being released, and the sperm can really get to it. So.
Yeah, that's great. I know there was a doctor that gave a talk, and she, you know, her advice was have sex like rabbits. That was her advice. I mean,
that fertile window.
Yeah, she was like, as many times as you can.
Yeah.
And it's, you know, it's good advice.
Yeah.
Dana, thank you for following up. Dana Lynn, X27. She's only 25, so I'd really recommend that second opinion on the premature ovarian failure number, since she is going in for weight loss surgery. In particular, I just want to infuse a little hope, not false hope, just get a second opinion on that and see what happens kind of with the weight loss. But I would be doubtful of a diagnosis only based on your FSH number.
Right.
So if you're, you know, antral follicle counts, AMH has to play a part. And Dr. Raquel always talks about the ratio of the hormones, the ratios, right? So maybe get through your procedure. That's the right thing for you. And, you know, take those 6 months to a year to achieve the goal that you have set for you, that you know, that you have, and then, you know, look at, and then retest everything.
Yeah, exactly.
Because I'm not, and even with the FSH of 16, I'm kind of doubting. So yeah, she said she would love to. Perfect. Yeah. Get in touch. I will help. And you are so welcome. We love you. Alexandra, let's see. She had her second IVF and both were successful, but with loss at 7 weeks. She found out about MTHFR and APS and PAI. She started taking folate is it methylfolate that you started taking, Alexandra, or just folate? B6, B12, B9, the NAC, and Lovenox was prescribed. Can she now try with IUI with kind of that medication regime?
Yeah, so that's very important about that MTHFR mutation. And I know we kind of talked about that a couple of weeks ago too, because what happens is your body is not, especially a lot of biological processes that happen in our body. Some of us take these supplements that are just flat out ineffective in helping us.
Right.
And so especially when it comes to clearing homocysteine, and I think that's what she might be just
trying
talking more about. Yeah. And
Uh-huh.
so when you have this MTHFR mutation, you can't clear homocysteine, which is at high levels can cause all types of chronic disease. So not just infertility, but like heart disease. So many like chronic health diseases are tied to high homocysteine. And so I'm thinking that's maybe why she was prescribed like maybe hopefully methylfolate.
Yeah.
But the reason why they gave you the different B vitamins, especially B2 and B6, is because they're needed for phase 2 liver detoxification. And so you have to have those B vitamins to really push out those toxins and anything that could be disrupting your system. I definitely recommend giving yourself some time, like maybe even like 6 to 8 weeks to really allow the supplements to absorb. And then, yeah, definitely try again. Because now your body should be more efficient at clearing toxins.
Yeah, very interesting. And Alexandra, I don't know if you got the full fertility genetics when you did your genetic testing for MTHFR, MTFHR. Did I say it right?
MTHFR. Yeah.
Just always think of the bad word. I know. So what I'm just advocating that if you want to talk to a genetic counselor that specializes in reproductive health, we have those available. They're the lowest cost in the country. So please let me know if I can set you up with that. If you're already in the app, you can just request the consult because we've already matched you to somebody in your area. And if you are outside the U.S., you can contact any of them. So you can just pick which one you like the most. We have a great partner for that. And the other thing I think for her to know about those is Myers cocktail, right? So because the intravenous vitamins for somebody who's trying to get the best absorption, it's something probably to look into.
Yeah, and making sure when you go to have because Myers cocktail, you can't manipulate it, and I don't think a lot of people know that. But Myers cocktail is actually patented by a doctor from Johns Hopkins. So it's like a patent. So you can't manipulate a Myers. You can add to.
I see.
But you can't like change the formulation. It comes already compounded. But you want to make sure. So with the Myers, all of the ingredients are active. But if there's a doctor that's giving you a modified Myers, which is very popular, just make sure they're using the active form.
Yes, okay. Which is the point of methylfolate. It's the activated form of folate. Got it. Okay, perfect. Lacey Egho has PCOS, lost 45 pounds. Oh my God, that's amazing.
I know that was hard to do.
I know, that's amazing. I know that took discipline. I mean, that's amazing. Congrats. Yes. And mentioned that her ovulation doubled. She's not pregnant yet. Can you clarify for us, Lacey, what you meant by your ovulation doubled? Like as in, you are ovulating twice more than you used to, but you're still not ovulating every month. Because I think with that weight loss and that healthy weight loss, maybe adding Clomid, that might be a good Clomid opportunity. And, we caution against the overprescription of Clomid, but Lacey, we do have a virtual care provider who's an REI, but he does a really cool program, a 6-month program for perfect. You're kind of a perfect candidate for it because you've already optimized your weight to be where you need it to be. And if you already have some positive indication of ovulation, do need to make sure your tubes are open, right? So that would be an important thing. Make sure your tubes are open. But if you want to see if you qualify for his program, it's super affordable. We also work with a partner that we love so much called Honeybee Health. And Honeybee Health, their Clomid prices are lower than your copay at CVS if you use your insurance. They have conscious pricing, wholesale pricing on all their medications, and they do carry both Clomid and Metformin. So for those who have PCOS, who are embarking on like a Clomid or Metformin assisted cycle, their prices are so low. I mean, it's, metformin, you end up saving about $120 per year by switching to them off of your copay. Yeah, like off your copay. What's the point of insurance? I mean, when you start looking at it, and then, and then Clomid's only $3.
That's
$3 per month. So you can, I think we have a code too. I think it might just be Fertility Answers. I'll have to find out, but I think Fertility Answers 10 maybe. I'll double check. But if you are embarking on a cycle, I wanted everybody to know about that too. It's so affordable. It's just great. And Lacey, she follows a diabetic diet now. Yeah, to keep the weight off, which makes sense. Having PCOS and the insulin resistance and everything.
That's awesome.
Yeah, good for you. So inspiring.
Wow.
That's so great. Yeah. C. Darcusio, are you Italian? Let's see. Advice for someone who has been going through infertility and still has unknown infertility. All the tests come back great, but still don't know what's wrong. They've been trying for 3 years. So we hear this a lot.
Yeah. Unexplained infertility is a real diagnosis, but one thing that a lot of, naturopathic doctors and functional medicine doctors always ask is, what do you mean by great? If your levels come back as just normal is not good. Mm-hmm. So if you tell a doctor something is wrong and they test different factors and then they say, oh, well, everything's normal, but normal is not optimal. So you want to make sure that whatever they're testing is in an optimal range. If a doctor wants your FSH below 10 and it comes back at 11, that's not optimal. That's just good. And so you just want to make sure. You never want to be at that cutoff. You never want to be at 10.
Right.
Or you never want your estrogen to be at 75. You want to make sure that you are always operating like in this optimal range. Mm-hmm. So I would just really look at my labs and see where am I falling in these levels. And then if you can, also ask your doctor to and this is actually covered by insurance, which a lot of my colleagues use to test for inflammation, just asking them to run a CRP to just test for inflammation. And it's, super affordable if you have insurance. Yeah. And it can really just give you a really quick way to know if there is any underlying inflammation.
I think also if you only tested with your OBGYN, there's certain tests that they're not doing. So even when they say, oh, it looks great, they probably haven't looked at Inhibin B. They might not even be reading the lab ratios the way that an REI would be reading them. Their equipment, even for an antral follicle count, is not the sophisticated level that an REI's equipment is. Yeah. So I would also just encourage you to maybe consider, we have a lot of consults available, some free, some paid, but we negotiate the best rate on behalf of our users if you want us to find you a second opinion to look at your case. And I would say even get on the app and fill out that health profile. Put in the labs, and then ask the question. We, say like, well, if it was an OBGYN versus an IVF doctor, what your antral follicle count was, et cetera. And then some of the other things that, Dr. Raquel has brought up that are kind of hidden things that an REI doesn't usually look for, like heavy metals, and the gut health and just the insulin resistance in general. And there's just, there are those other things, to kind of optimize in the right direction.
Yeah, and I always, even with friends or patients, anyone I meet, it's so easy to, because REIs are OBGYNs, it's so easy to say, well, my OBGYN said it, so that means that. Right. And it's, REIs are, it's a specialty, and it's a very, intricate, very unique specialty where there's only some things that a fertility doctor can do and interpret for you.
Exactly.
And sometimes I know, especially for some of my friends who their OBGYN told them, oh, you'll be fine, just give it time. That's not true. Only an REI can tell you that your fertility is in good standing.
Exactly.
Just saying it based off your period is not a reliable indicator to tell you if you will suffer with infertility or not. None of us really know, and so that's why apps like this are so important, because you literally create access in this way to say, I'm having these problems. What's your advice? And you're getting it from a real professional. So
I think that the confusing part for the market is, you don't go to your OBGYN and ask her to treat you for migraines.
Right.
And people need to understand infertility is its own specialty, like migraines or like urology or like cardiology. Your OBGYN might be like, oh, I noticed your blood pressure is high today. I think you need a referral to a cardiologist. Get with your primary care doctor so you can work on that. They're not going to be the ones that treats you for that. That's out of their medical ethics. They're not supposed to be treating you for infertility. And so I think that's the thing that we're so passionate about, assembling this network and making sure that we get people the consult access, because it's the only area of medicine where we're not rapidly referring people in for a proper consult. I mean, why is my average struggling user has already struggled for 19 months before even finding us, let alone getting in for a consult. And some people have struggled for 3 years without getting an IVF consult. And, you know, we're removing cost as the barrier. So we just want you guys to get the proper information as soon as humanly possible.
Yeah, exactly. I love that. I think this is so important. And to me, even if enough people don't see it, it's literally going to set ablaze even more than it has now, because we are seeing more people being okay with saying, like, no, I'm not okay with the answer.
Exactly.
Like, I want another opinion. Like, this is not okay. And I love that so many more men and women are finding their voice to just say, like, no, that's not okay. And when you get pushback from your OBGYN, I always say it's not because they don't want to help you, but that's not their specialty. That's
not their area. Exactly.
You have to make sure you're getting answers from the right channels. Yeah. For sure.
And not every doctor is not, you know, doctors don't like to talk about things that they're not expert at. They'll tell you that all the time. They say that all the time.
Say, I don't know.
That's not, exactly.
Like, don't know. Thyroid.
Exactly. Not my area. All right, 3 really good questions just came in too, and we're running late on time. You guys are running short on time. We're running late today. We're running short on time, so we'll try to answer the next few. So I'm going to skip right to one that Alexandra followed up on because she heard us talk about metformin and the B12 contraindication. So she was concerned, should she stop taking metformin because of the B12? We're not saying, no, you don't need to. You just need to take them separately. And Dr. Raquel, do you remember is the window 2 hours, 3 hours? I can't remember the window of time.
I'm actually making sure I look just to be sure, because I know it's long-term metformin use that depletes B12, but I don't know the time in between that you should take it. But I do know that it affects the absorption.
I think it's in our genetic report that we have for the fertility genetics, and so we can look that up for you, Alexandra. I think there's an action set for people like you who fit that profile. And it's a 2 or 3 hour window, I believe, where you just need to take your B12 separate from the metformin. And so, you know, maybe you take, you know, one at lunchtime, and you take your prenatal in the morning, and you take, you know, or you take all those vitamins in the morning and you take your metformin at lunch, whatever works for you, but just spaced apart is the important thing, so that your body has a chance to absorb them separately, so that it doesn't block the absorption. And then XOXO Providence, love seeing you. Thanks for joining us again. Would Ovastatil be beneficial for PCOS? Totally.
I saw that. That's just myo-inositol, just with a brand.
Yeah, exactly.
But so myo-inositol is great.
Yeah.
Great for PCOS. Yeah.
And it's been around for so long.
It's been around for so long, and I feel like, I mean, no shade, but naturopathic doctors have been doing things so long that now other doctors are just learning about and making it popular. Yeah. But myo-inositol is so, and I said no shade because I'm not hitting on doctors. I'm just saying, you know, we've been doing this for a while. But no, myo-inositol is great because it not only helps with hormonal balance, but it also helps with egg quality, especially in conjunction with melatonin.
So great. Love the melatonin. Marie Evans, or Marie Vans maybe, how to get a period with PCOS. She hasn't had one in 8 months and her doctor won't give her anything. Okay.
Yeah.
I know. Can we find you a new doctor?
Right.
Let's find you a new doctor. Like, let's just, first of all, get a full workup going for you. Not having a period for 8 months is very much not okay, and it's not normal. And you have PCOS. We need to get you in with a specialist. Yeah. So please, you know, hop on the app, request a consult, DM me. I will find you somebody personally in your area. I'll find you somebody virtually. I will find somebody with whatever financial situation that you have that you can afford to have proper care and treatment. We can check your insurance even. You know, we will go to bat for you, Marie Van. So please reach out. But I want you to have a different doctor. It's not okay. Lauren does not have PCOS. Thank you for clarifying that. Okay. I think that was just an important consideration about the ovulation kits. So, yeah. So, the best at-home, ovulation test for women with PCOS. So the one, Court, we work with is called prove.life. So prove, I think that one definitely has a discount code. I think it's Fertility Answers 10. I think they're all Fertility Answers 10, but I really should know this. So DM me to clarify that for you, Court, to get a percentage off. But yeah, it's fantastic. So even our virtual care provider who does, he does virtual Clomid cycles, virtual superovulation cycles. He'll use that kit because there is a doctor portal to see your results. And the cool thing is it's a quantitative level. So it's just like having a lab at your house. It is through urine, but their algorithms and their technology is so good, you're getting an actual number. So it's like a beta HCG for ovulation confirmation.
Oh, that's amazing.
Which I love. I know.
Yeah,
I love
that's
it.
amazing.
So great.
Yeah.
Alyssa saying thank you so much for taking time to answer questions, makes her feel better going into the procedure and gives her a little more hope. 2 years trying to conceive, I'm hoping. Us too. I mean, please keep us posted, Alyssa. You know, and I hope that now that you know that the polyps were there and you're getting it treated, that does lead to the breakthrough that you need, because 2 years is a long time. Let's see. All right, guys, we're only going to try a couple more questions because we're coming up on the time I have to go feed my 7-year-old, and boy, do they eat a lot.
I know. I want to. Oh, sorry. Go ahead.
No. You first.
I just saw one that made me very nervous because I literally just donated to a dad whose mom died just giving birth. And I see somebody who is like having extreme hypertension with headaches and nausea, and her OB won't give her anything. You should go to the emergency room right now. I can't see her name. It's like pretty
sick, 33.
33.
Yeah, you got to go.
You should go to the emergency room.
Yeah.
For sure. Yeah, because it sounds like preeclampsia. And that could lead to death for you or your child. So sorry, I just saw that.
Yeah, I mean, Dr. Raquel she's being medically ethical right now. Pretty sick, 33. They will, yes. I think you need to go right away.
Yeah. Preeclampsia is very dangerous. So,
very dangerous. And that's very concerning. Court Mitch, would you recommend getting your tubes checked when on Clomid? You should have your tubes checked before going on Clomid. Yeah. Because there's no point of going on Clomid if your tubes aren't open. And so that makes no sense to me that your OB would recommend waiting to 6. This is what frustrates us. It's like, oh my gosh, you're going to waste 6 months if your tubes are blocked. Just go check to see if your tubes are open. Please reach out. Let me get you into, in with somebody who can do that. And this, you know, I mean, I know I'm sure her OB's heart is in the right place. You know, knows how to diagnose Clomid, but that makes 0 sense.
Yeah, exactly. Exactly. Yeah.
One last question. Lady O'Toole, low AMH and start injections for second round of IVF this week. She, CoQ10 with egg quality, and also, I love CoQ10 for brain quality too. So, I mean, take it anyway. Egg quality, brain quality, like it's like a really great supplement, and you can only get it in beef heart. Did you know that? Is that a fun fact maybe that I just taught you?
Wow, I didn't know that.
So we're meat eaters in my house, and I learned that beef heart is the only food source of CoQ10. Isn't that crazy? Yeah.
That's crazy. I need to start eating more beef heart.
I know. Well, you know what I did? Because it definitely has a different flavor and texture to it than like the filet. And so I would chop it really, really tiny because you get a 5-pound beef heart. It's huge. So I would just chop it super tiny and then mix it into like ground beef or whatever, just because a little bit goes a long way.
Yeah.
So I'm sorry if I just offended our vegan audience, but my son came out a carnivore. Like he loves his meat.
I know. I love it. That's such a good way to like get it in too.
Yeah. Because we do like we get our vitamin A from eating liver.
Yeah.
I tend to prefer chicken liver over other livers, and so we get a lot of vitamin A that way. So yeah, CoQ10. And all right, back to her question. Are they good supplements to take? She's taking melatonin. Oh, yeah. She's taking 2 of our favorites, melatonin and CoQ10. So like you're on the right path. That's great.
You're on the right path. That's awesome.
Yeah, totally. All right. Well, we love you guys so much. We're sorry that we can't keep going super long. But we I just am so grateful for everybody being here, and whatever, you know, if you have further questions, please hop on the app and ask them. That's why we do this, so you know the kind of experience you can get on the Fertility Answers app too. You're totally anonymous though on that app, And we have 14 or 15 different types of experts that can answer your questions. So we will see you next week, same time, same place. And if you love this, open forum Q&A, we'll just keep it going.
Yeah, it's so fun.
We love doing it.
Yeah.
All right. Thanks, everybody. We'll see you next time. Thank you, Dr. Raquel.
Thanks. Bye.